Natural rewards. For the brain, the difference between normal rewards and drug rewards can be likened to the difference between someone whispering into your ear and someone shouting into a microphone. Just as we turn down the volume on a radio that is too loud, the brain of someone who misuses drugs adjusts by producing fewer neurotransmitters in the reward circuit or by reducing the number of receptors that can receive signals. As a result, the person's ability to experience pleasure from naturally rewarding activities is also reduced. This is why a person who misuses drugs eventually feels flat, without motivation, lifeless, and or depressed, and is unable to enjoy things that were previously pleasurable. Now the person needs to keep taking drugs to experience even a normal level of reward, which only makes the problem worse, like a vicious cycle. Also, the person will often need to take larger amounts of the drug to produce the familiar high and effect known as tolerance. Long-term drug use impairs brain functioning. For more information on drugs in the brain, order Naidac's Teaching Addiction Science series or the Mind Matters series. Other mental disorders or vice versa. Drug use and other mental disorders often coexist. In some cases, mental disorders such as anxiety, depression, or schizophrenia may come before addiction. In other cases, drug use may trigger or worsen those mental health conditions, particularly in people with specific vulnerabilities. Some people with disorders like anxiety or depression may use drugs in an attempt to alleviate psychiatric symptoms. This may exacerbate their mental disorder in the long run, as well as increase the risk of developing addiction. Treatment for all conditions should happen concurrently. Beyond the harmful consequences for the person with the addiction, drug use can cause serious health problems for others. Some of the more severe consequences of addiction are negative effects of drug use while pregnant or breastfeeding. A mother's substance or medication during pregnancy can cause her baby to go into withdrawal after it's born, which is called neonatal abstinence syndrome. Symptoms will differ depending on the substance used, but may include tremors, problems with sleeping and feeding, and even seizures. Some drug exposed children will have developmental problems with behavior, attention, and thinking. Ongoing research is exploring if these effects on their brain and behavior extend into the teen years, causing continued developmental problems. In addition, some substances can make their way into a mother's breast milk. Scientists are still learning about long term effects on a child who is exposed to drugs through breastfeeding. Negative effects of secondhand smoke. Secondhand tobacco smoke exposes bystanders to at least 250 chemicals that are known to be harmful, particularly to children. Increased spread of infectious diseases. Injection of drugs accounts for 1 in 10 cases of HIV. Increased risk of motor vehicle accidents. Use of illicit drugs or misuse of prescription drugs can make driving a car unsafe, just like driving after drinking alcohol. So this is just a little bit of what I'd like to discuss here. Can addiction be cured? Like other chronic diseases, such as heart disease or asthma, treatment for drug addiction usually isn't a cure, but addiction can be managed successfully. Treatment enables people to counteract addiction's disruptive effects on their brain and behavior and regain control of their lives. These images showing the density of dopamine transporters in the brain illustrate the brain's remarkable ability to recover, at least in part, after a long abstinence from drugs. In this case, methamphetamine. And there you have it. Comparison of relapse rates between substance use disorders and other chronic illnesses. There is substance use disorders, hypertension, and asthma. So asthma shows this 50-70%, while hypertension is 50-70%, and substance use disorder is 40-60%. All right, there you have it. I hope you've enjoyed our little chat.